Healthcare Committee in India. First is Board Committee B for BDC, and from Board you can remember BDC. B is for Board Committee, D for Development, and C is Committee. It will basically to look after all the primary health cares like social physicians, create the sub-center, PHC and all. And then there is a Mudlar Committee. Mudlar Committee, you remember it like must plan your Sunday. Must plan your Sunday, that is M for MU. Must ka MU is a Mudlar, and plan is planning, health planning. As for health survey, and D ka D is equal to district hospital. It is basically for post of specialists in the district hospital also. And it is for health survey and health planning committee. And Chadda ka C is condom, and it will from condom you will remember family planning. And for Chadda is a good person. He want or everyone is he wants the family planning and malaria thing to be done together, to be looked after by the same person only. But Mukherjee, he wants to divide the work between the male and female. The same thing, the malaria and M for malaria. And from Chadda you can remember family planning, and from Mukherjee you can remember M for malaria and M for and he want to divide the work among the healthcare worker, male and female. And the female will look after family planning, and malaria will look after we would be looked after by the healthcare worker male. And then the Jungalwala committee. Jungalwala actually he does justice. J for Jungalwala and J for justice. And what kind of justice he does? He pays equally for equal work. For specialized doctors, he will pay special pays for specialized doctor, and a recognition of the extra medical degree. But one bad thing he does is that N for no, there is no private practices are allowed. Then there is a Carter is nothing such as mnemonic is there, you remembered it like that only. It is healthcare worker male, healthcare worker female, and a medical officer. Then is a Srivastav committee. Srivastav is like remember someone who has a title of Srivastav. Actually, he's a good person because he will go abroad, he will get educated and return to his home country and serve the poor people. So he has gone abroad for medical education. That is what kind of it is Rome. Rome is reorientation of you can remember he has gone to Rome only. It is reorientation of medical education, and then he has come to his home country and is serving the poor people in the village. And in village he is looking after the village health guidelines, rural health infrastructure and referral resources. Then there is a Krishna. This Krishna is someone rich, who is very rich, you can remember. So he's a rich person who looks after the rich means who stays in the urban thing and looks after the urban health. Bajaj is a friend of Srivastav, but he is a kind of selfish because he will only study. He is for for national medical. He will only study, but will not look after the village things. So he will only study means study is medical education, national medical education policy. But he will not go abroad. Bajaj will study in India only. So it is study medicine in India. So it is for national medical education policy. Now it is Tendulkar. Tendulkar we know is Sachin is a very good person, but this Tendulkar is a bad person in the sense he had started this breach course, and you can remember. But Tendulkar, what other things he has done? He has actually is a high level of expert committee. We know Tendulkar is expert in his field, so Tendulkar is an expert committee. Tendulkar, one bad thing he did is that he started the breach course, but he had also revised the BPL cutoff and universal coverage. Thank you.